1. A registered behavior technician is training a new technician. Which strategy best supports adult learning principles? A. Using lecture-style instruction for consistency. B. Providing opportunities for real-world application. C. Repeating instructions without variation. D. Assigning readings without discussion. 2. An RBT mentor notices a mentee is struggling with data collection. What is the most appropriate feedback approach? A. Publicly correct the error to reinforce accountability. B. Ignore the issue and hope improvement follows. C. Provide constructive, immediate, and private feedback. D. Recommend the mentee retake training modules independently. 3. Which of the following reflects effective curriculum development for adult learners in behavior analysis? A. Including abstract theories without application. B. Designing learning activities around passive observation. C. Centering instruction on interactive and problem-based tasks. D. Emphasizing rote memorization of terminology. 4. During a clinical skills evaluation, the RBT uses a checklist. What is the primary benefit of this method? A. Subjective rating of performance. B. Reduced training documentation. C. Objective assessment of competency. D. Quick dismissal of underperformers. 5. What is the most appropriate way for an RBT to mentor a colleague with different learning preferences? A. Apply the same teaching strategy to ensure consistency. B. Adapt strategies to align with the mentee's learning style. C. Require the mentee to adjust to the mentor's methods. D. Deliver feedback exclusively through written formats. 6. Which scenario best demonstrates ethical communication and supervision? A. Providing informal guidance without documentation. B. Using professional jargon to establish authority. C. Engaging in transparent, respectful dialogue with feedback. D. Withholding negative feedback to maintain rapport. 7. In regulatory compliance, which documentation practice is most critical? A. Handwritten notes on scrap paper. B. Real-time, accurate, and confidential records. C. Group data entries to save time. D. Occasional summaries without timestamps. 8. What is the key purpose of formative assessment in RBT training? A. Certifying final competency. B. Monitoring ongoing progress for adjustment. C. Evaluating client satisfaction. D. Creating annual performance reports. 9. When teaching data collection to a new RBT, what should be emphasized first? A. Use of abbreviations for speed. B. Personal interpretation of behaviors. C. Operational definitions and accuracy. D. Completion at the end of the session. 10. A new RBT is having difficulty implementing a behavior plan. What is the most appropriate mentoring strategy? A. Encourage observation of an experienced technician. B. Increase independent practice without support. C. Reduce expectations for plan fidelity. D. Delay further mentoring until next quarter. 11. How should an RBT approach a mentee who consistently arrives late to training sessions? A. Report them immediately to HR. B. Terminate the mentoring relationship. C. Address the concern directly and explore causes. D. Ignore the issue to avoid confrontation. 12. Which instructional design principle is best when developing content for adult RBT trainees? A. Minimize learner autonomy. B. Include theoretical concepts only. C. Integrate practical and experiential learning. D. Avoid learner feedback. 13. When an RBT trainee demonstrates skill fluency, what is the next appropriate step? A. Cease supervision entirely. B. Introduce more complex client scenarios. C. Repeat basic skills for mastery. D. Rotate to administrative duties. 14. What is one of the most effective tools for evaluating a new RBT's instructional fidelity? A. Verbal affirmations. B. Self-assessment only. C. Direct observation and performance checklists. D. Delayed supervisor review. 15. An RBT instructor notices trainees are disengaged during a virtual training session. What adjustment could improve engagement? A. Increase text slides and readings. B. Limit interaction to maintain pace. C. Incorporate polls and case-based discussions. D. Extend the session length. 16. What is the best way for an RBT to ensure understanding when explaining a complex concept? A. Ask the learner to paraphrase the concept. B. Provide the definition and move on. C. Refer them to a textbook chapter. D. Skip the concept if time is limited. 17. Which of the following reflects a violation of RBT supervisory guidelines? A. Providing weekly feedback. B. Offering correction during a session. C. Supervising without a current BACB credential. D. Using a task analysis to coach performance. 18. What is the most appropriate response to an RBT trainee who questions a procedure? A. Remind them not to challenge authority. B. Encourage discussion to promote understanding. C. Mark them down in their evaluation. D. Avoid further engagement on the topic. 19. A new RBT performs inconsistently across different clients. What strategy supports improvement? A. Assign them to fewer cases. B. Provide targeted role play and guided rehearsal. C. Focus on written assessments only. D. Allow them to choose clients independently. 20. How should feedback be structured to maximize impact during RBT mentorship? A. Vague and infrequent. B. Immediate, specific, and actionable. C. Annual and generalized. D. Indirect and anonymous. 21. What is the best method to evaluate the generalization of a skill taught by an RBT? A. Reassess in the training environment only. B. Observe skill performance across multiple settings and contexts. C. Assume generalization if performance is strong in sessions. D. Interview the client's caregiver only. 22. An RBT trainee expresses frustration with data entry tasks. What approach would address this using adult learning theory? A. Reassign data tasks to another RBT. B. Explain the purpose and link to client outcomes. C. Ignore their frustration to avoid discouragement. D. Assign extra data tasks as practice. 23. Which form of feedback is likely to result in the greatest behavior change? A. Public criticism. B. Timely and specific praise for desired behavior. C. General reminders at weekly meetings. D. Nonverbal disapproval during sessions. 24. In terms of curriculum development, which approach is most appropriate for new RBTs? A. Linear delivery without learner input. B. Scaffold content with opportunities for practice. C. Extensive theory with limited hands-on tasks. D. Repetitive worksheets to reinforce memorization. 25. When implementing a mentoring plan, which element is essential for success? A. A rigid timeline for all learners. B. Clear goals and measurable outcomes. C. Exclusive use of pre-recorded materials. D. No evaluation to avoid learner anxiety. 26. What strategy supports ethical boundaries in RBT mentorship? A. Accepting friend requests on social media. B. Keeping communication channels strictly professional. C. Discussing personal problems during supervision. D. Sharing client stories for entertainment. 27. Which best describes a summative assessment in the RBT training context? A. Mid-training check-in discussion. B. Real-time verbal coaching. C. Final evaluation of competency after instruction. D. Unofficial peer feedback. 28. An RBT instructor wants to promote critical thinking. Which strategy is most appropriate? A. Provide clear answers without elaboration. B. Encourage debate and discussion around case examples. C. Discourage questions to maintain order. D. Assign extra readings with no application tasks. 29. How can a mentor help an RBT improve their functional communication training delivery? A. Provide general encouragement only. B. Offer modeling, role play, and structured feedback. C. Let them watch a video and try it on their own. D. Ask them to research online without guidance. 30. Which is the most effective way to assess an RBT trainee's ability to collect ABC data? A. Review their written notes once per month. B. Ask them to define ABC terms. C. Observe them during a session and review accuracy. D. Assign a multiple-choice test. 31. What is one legal risk of improper documentation by an RBT? A. Slight inconvenience for the supervisor. B. Client dissatisfaction with services. C. Violation of HIPAA or other confidentiality laws. D. Delayed billing submission. 32. When developing a new training for RBTs, what should be prioritized? A. Trainer's convenience. B. Alignment with task list and learner needs. C. Inclusion of excessive jargon. D. Avoidance of feedback loops. 33. A mentor observes an RBT using a different prompt hierarchy than outlined. What is the best course of action? A. Allow creativity in methods. B. Provide corrective feedback in model correct hierarchy. C. Ignore unless there is a complaint. D. Remove the RBT from the client case. 34. What makes a case-based scenario effective in adult education for RBTs? A. It is brief and disconnected from real cases. B. It provides open-ended problem-solving opportunities. C. It focuses only on textbook definitions. D. It requires memorization of responses. 35. A mentee is progressing slowly. What should the mentor adjust first? A. Lower performance expectations. B. Increase complexity of tasks. C. Modify instructional strategies or pacing. D. Reduce the frequency of feedback. 36. Which of the following aligns with evidence-based adult learning? A. Unidirectional lectures with no discussion. B. Repetition without variation. C. Hands-on practice and immediate feedback. D. Mandatory textbook quizzes only. 37. Which communication method is most appropriate for a supervisory correction? A. Group announcement. B. Email to all staff. C. One-on-one discussion with direct feedback. D. Posting notes in the break room. 38. Which is most important when creating a training plan for new RBTs? A. Personal anecdotes. B. Measurable learning objectives. C. Complicated terminology. D. Outdated examples. 39. What is one way to improve trainee retention of ethical guidelines? A. Use real-world ethical dilemmas in practice discussions. B. Read the guidelines once at the beginning of training. C. Avoid role-play to prevent confusion. D. Skip ethical content until certification. 40. An RBT trainee consistently fails to follow the behavior plan. What is the best first step? A. Document and report for disciplinary action. B. Review the plan and observe implementation together. C. Assign them to a new client. D. Have them write an apology. 41. In what way can reflection be built into mentoring of RBTs? A. Require journaling of weekly practice challenges. B. Skip reflection to save time. C. Focus only on performance data. D. Offer reflection opportunities quarterly only. 42. Which evaluation method is best for tracking skill acquisition over time? A. Snapshot observations. B. Pre- and post-assessments with interval checks. C. Verbal self-report. D. Peer discussion. 43. What is a key component of culturally competent mentoring? A. Ignore cultural differences to treat all equally. B. Incorporate cultural values into discussions and examples. C. Focus only on standardized training modules. D. Avoid asking about culture. 44. A trainee asks about the rationale for using DTT. What is the most effective mentor response? A. Say it's required and move on. B. Explain the principle of structured teaching and how it applies. C. Recommend reading a textbook. D. Avoid responding to preserve session time. 45. When providing feedback on session notes, what should a mentor prioritize? A. Formatting only. B. Content accuracy and clarity. C. Word count. D. Handwriting style. 46. An RBT trainee is anxious during role play. What strategy could reduce anxiety while promoting learning? A. Remove them from role play exercises. B. Pair with a peer in a supportive environment. C. Increase performance pressure to build resilience. D. Eliminate practice and use lecture only. 47. Which action is required under HIPAA for RBT documentation? A. Share client data via email without encryption. B. Store paper records in an unlocked cabinet. C. Limit access to client data and ensure secure storage. D. Allow coworkers to borrow documentation freely. 48. How can mentors promote self-assessment in RBT trainees? A. Have trainees complete a skills checklist with guidance. B. Perform all evaluations for them. C. Only rely on peer reviews. D. Discourage self-reflection until training ends. 49. What is the best way to support generalization in skill training? A. Practice in only one environment. B. Introduce multiple settings and stimuli. C. Avoid changing materials during training. D. Focus only on tabletop tasks. 50. A new RBT claims to understand task analysis but applies it inconsistently. What should the mentor do? A. Accept partial accuracy. B. Provide corrective feedback and additional modeling. C. Assign them a quiz on task analysis. D. Ignore unless a client is harmed. 51. In behavior skills training, which component comes first? A. Feedback. B. Role play. C. Instruction. D. Modeling. 52. What is the benefit of real-time coaching during a session? A. It reduces trainee accountability. B. It provides immediate correction and reinforcement. C. It disrupts client services. D. It delays feedback for analysis. 53. A curriculum with frequent assessments offers which advantage? A. Discourages creativity. B. Improves retention and adjustment. C. Increases workload. D. Minimizes trainee engagement. 54. When mentoring RBTs, how should corrective feedback be framed? A. As criticism for poor performance. B. With actionable steps and encouragement. C. Through passive-aggressive remarks. D. Only in written form. 55. What defines a high-quality RBT training curriculum? A. Focus on credentials over practice. B. Use of outdated material. C. Emphasis on competency-based objectives. D. Lack of learner participation. 56. When should an RBT trainee's competency be evaluated? A. Only after 1 year of training. B. After each session. C. Periodically, aligned with skill acquisition. D. Only after a complaint. 57. Which method best addresses a trainee's need for clarification? A. Telling them to figure it out. B. Providing examples and inviting questions. C. Redirecting them to another trainee. D. Withholding help to build resilience. 58. A mentor models appropriate reinforcement delivery. What is the next training step? A. Repeat modeling only. B. Have the trainee read a policy. C. Guide the trainee through role play and give feedback. D. Assign a written test. 59. What is the most effective way to teach RBTs about reinforcement schedules? A. Provide a list of definitions. B. Lecture with no follow-up. C. Use interactive demonstrations and case studies. D. Skip the topic unless asked. 60. A supervisor needs to ensure compliance with BACB supervision requirements. What action is necessary? A. Provide supervision only if requested. B. Document supervision hours and maintain required ratios. C. Use informal check-ins only. D. Delegate supervision to unqualified staff. 61. An RBT trainee is making errors during client transitions. What training method would best support improvement? A. Provide modeling and have the trainee practice under observation. B. Refer them to the manual without follow-up. C. Assign them administrative tasks instead. D. Wait until quarterly review to address. 62. What does it mean to scaffold instruction in RBT mentoring? A. Teach only one topic. B. Gradually build complexity while offering support. C. Repeat the same instructions each time. D. Provide tests before any instruction. 63. Which component is essential in a behavior intervention plan and must be taught to RBTs? A. Supervisor preferences. B. Target behavior definitions and function. C. Client's school schedule. D. Family's opinion on therapy. 64. How can an RBT mentor address differing learning speeds among trainees? A. Hold all trainees to the same timeline. B. Adjust training pace and support based on individual needs. C. Ignore differences to promote fairness. D. Focus only on fast learners. 65. Which technique would best enhance the critical thinking of an RBT during skill acquisition? A. Provide scenarios that require analysis and decision-making. B. Use fill-in-the-blank worksheets. C. Assign silent reading time. D. Avoid questioning to maintain authority. 66. When should a mentor document performance concerns with an RBT trainee? A. Only after 3 repeated issues. B. Immediately, with objective examples. C. Never, to maintain rapport. D. Only if the trainee asks. 67. An RBT mentor is creating a checklist for skill assessment. What should be prioritized? A. Supervisor convenience. B. Observable and measurable behaviors. C. Subjective impressions. D. Emotional responses of the trainee. 68. Which strategy best supports adult motivation to learn in RBT training? A. Emphasize the consequences of failure. B. Connect content to real job responsibilities. C. Use general language and vague objectives. D. Test frequently without explanation. 69. A trainee continues to misuse reinforcement. What should a mentor do? A. Assign extra sessions without explanation. B. Observe and provide immediate corrective coaching. C. Reduce their client hours. D. Encourage them to read more. 70. What defines competency-based training for RBTs? A. Time-based progression through material. B. Mastery demonstrated through performance. C. Completion of reading assignments. D. Trainee satisfaction surveys. 71. Which element is critical for ensuring effective supervision of RBTs under bacb guidelines? A. Monitoring by peer employees. B. Providing feedback once per month only. C. Ongoing performance evaluation and documentation. D. Verbal instruction without written records. 72. An RBT trainee asks for more clarity on extinction procedures. What should the mentor do? A. Avoid the topic and move on. B. Explain and demonstrate the concept with examples. C. Refer the trainee to a glossary. D. Wait until the trainee experiences a crisis. 73. When preparing training content for new RBTs, what principle should guide content inclusion? A. Amount of available training time. B. Relevance to real-world responsibilities. C. Availability of flashcards. D. Ease of instructor delivery. 74. How should a mentor handle trainee resistance to feedback? A. Avoid giving further feedback. B. Clarify the purpose and invite reflection. C. Refer the trainee to another supervisor. D. Report the issue without discussion. 75. What is the purpose of backward chaining in skill instruction? A. Teaching the entire chain at once. B. Teaching the last step first to build success. C. Starting with error correction. D. Using reinforcement randomly. 76. An RBT mentor wants to evaluate maintenance of a learned skill. What is the best strategy? A. Review training documents. B. Observe skill performance weeks later in the same context. C. Ask the trainee if they remember. D. Provide a written test. 77. Which characteristic is typical of adult learners? A. Passive learning style. B. Need for immediate relevance to practice. C. Preference for repetition without feedback. D. Inability to self-direct. 78. What is the primary focus when coaching an RBT on professional boundaries? A. Client's perception of friendliness. B. Adherence to ethical guidelines and respect. C. Supervisor's personal beliefs. D. Popular trends on social media. 79. When co-training RBTs with a colleague, what promotes communication and consistency? A. Alternating instruction without planning. B. Documenting sessions separately and privately. C. Meeting to align objectives and delivery. D. Dividing topics randomly. 80. A mentor creates case studies for trainees. What ensures high impact? A. Using real-world challenges and requiring analysis. B. Simplifying facts to avoid confusion. C. Limiting detail to save time. D. Providing only one correct answer. 81. How can mentors increase training retention among RBTs? A. Rely solely on printed materials. B. Use multimodal instruction and active participation. C. Minimize practice to avoid fatigue. D. Skip reviews and assessments. 82. What is the most ethical response when an RBT expresses confusion about an assigned task? A. Tell them to follow orders. B. Redirect them to another staff member. C. Explain expectations and offer clarification. D. Suggest they figure it out independently. 83. A mentor wants to encourage autonomy in an RBT. What method supports this? A. Give them full independence without guidance. B. Set specific goals and allow for self-monitoring. C. Avoid discussions about performance. D. Delay evaluations. 84. What is the role of a task analysis in RBT training? A. Identifying unnecessary steps. B. Outlining clear, sequenced actions for instruction. C. Replacing the behavior plan. D. Reducing the need for supervision. 85. What is a key reason to use role-play in RBT instruction? A. It simulates real situations for active learning. B. It reduces the need for feedback. C. It avoids trainee questions. D. It shortens training duration. 86. When should RBTs be introduced to documentation protocols? A. After their first 90 days. B. Before their first client session. C. Only when there's a compliance issue. D. Upon supervisor request. 87. How can a mentor best address an RBT's inconsistent data recording? A. Provide structured retraining with performance checks. B. Delay discussion until next staff meeting. C. Email a reminder with no follow-up. D. Assign them fewer clients. 88. Which practice is essential in maintaining professional mentorship boundaries? A. Giving personal advice. B. Accepting gifts from ments. C. Keeping interactions focused on skill development. D. Inviting ments to personal events. 89. An RBT trainee needs help managing maladaptive behavior. What should be the mentor's approach? A. Assign a related article. B. Model intervention strategies and coach during practice. C. Reassign the case. D. Focus on other goals. 90. How does adult learning theory apply to RBT feedback? A. Adults prefer top-down correction. B. Adults benefit from collaborative, relevant feedback. C. Feedback should be limited to final evaluations. D. Avoid feedback to reduce defensiveness. 91. A training evaluation shows low comprehension of reinforcement types. What should the mentor do? A. Retest without reteaching. B. Modify instruction with more examples and practice. C. Blame the training format. D. Remove that section. 92. What method helps determine if an RBT has generalized a skill? A. Written quiz results. B. Accurate application in new settings. C. Verbal rehearsal. D. Supervisor intuition. 93. Which best supports peer learning in RBT mentoring? A. Independent assignments. B. Peer modeling with reciprocal feedback. C. Avoiding peer comparisons. D. Private learning tasks only. 94. How can a mentor encourage reflection after a behavior session? A. Ask trainees to list what went well and what could improve. B. Dismiss the session quickly. C. Provide only praise. D. Avoid debriefing to save time. 95. What is an indicator of effective clinical instruction? A. RBTs demonstrate skills across contexts with minimal prompts. B. RBTs memorize policies. C. All RBTs complete training in the same amount of time. D. There are no trainee questions. 96. When evaluating an RBT skill in teaching communication, what should be assessed? A. Use of gestures only. B. Accuracy, consistency, and context of instruction. C. Client compliance levels. D. Supervisor opinion. 97. What is one benefit of using visual aids in RBT training? A. They reduce practice time. B. They improve conceptual understanding and recall. C. They replace modeling. D. They increase trainer talk time. 98. A mentor includes practice with multiple exemplars. What learning principle is this? A. Chaining. B. Stimulus generalization. C. Prompt fading. D. Task reduction. 99. How can a mentor improve long-term retention of ethical practices? A. Role-play common ethical dilemmas regularly. B. Review the code once per year. C. Avoid discussing challenging scenarios. D. Use fear-based examples. 100. A new RBT resists collecting frequency data. What should the mentor do first? A. Explain the importance and demonstrate how to do it. B. Penalize them for non-compliance. C. Reassign them to less technical tasks. D. Ignore the resistance. 101. What should a mentor do to ensure consistency across multiple RBTs working with the same client? A. Allow each RBT to create their own approach. B. Provide standardized protocols and model implementation. C. Let the client dictate the method. D. Avoid discussing procedures in meetings. 102. When selecting training materials for RBTs, the mentor should prioritize A. Ease of instructor access. B. Alignment with task list and evidence-based practices. C. Entertainment value. D. Supervisor preference. 103. How can an RBT mentor assess fluency in a trained skill? A. Count the number of errors during instruction. B. Measure accuracy and rate of responding over time. C. Observe facial expressions. D. Review subjective reports. 104. What is a legal requirement related to RBT supervision under bacb guidelines? A. Monthly written exams. B. Direct supervision for a minimum percentage of hours. C. Full-time co-therapy with a BCBA. D. Self-directed professional development. 105. A mentor wants to promote problem-solving skills. What is the best method? A. Provide case studies requiring decision-making. B. Offer definitions for memorization. C. Emphasize compliance only. D. Repeat information without application. 106. Which action supports effective adult learning and performance feedback? A. Immediate, specific, and behavior-focused comments. B. Waiting until end-of-week reviews. C. Providing vague statements. D. Emphasizing personal opinions. 107. What should guide the frequency of feedback in clinical instruction? A. Daily fixed intervals regardless of performance. B. Trainee performance and learning progress. C. Supervisor availability only. D. Number of client complaints. 108. A mentor wants to measure the impact of a new teaching strategy. What is required? A. A casual conversation with trainees. B. Data collection on trainee performance before and after. C. Reading reviews online. D. A survey of client satisfaction. 109. What is the role of baseline data in RBT training? A. It determines final certification. B. It identifies starting competency levels. C. It replaces ongoing assessments. D. It serves only administrative purposes. 110. What is the key component of a mentorship agreement? A. Social bonding between mentor and trainee. B. Clear expectations, goals, and boundaries. C. Informal discussion topics. D. Mutual personal interests. 111. Why should mentors track fidelity of implementation? A. To identify and correct deviations from protocol. B. To reduce documentation responsibilities. C. To focus only on client behavior. D. To simplify training. 112. An RBT is consistently late to supervision sessions. What is the mentor's best first response? A. Ignore it until evaluations. B. Discuss expectations and document the concern. C. Reduce their hours. D. Email HR without context. 113. What element of instructional design helps accommodate different learning styles? A. A single format for all content. B. Use of visual, auditory, and kinesthetic methods. C. Reliance on lectures only. D. Assigning more reading. 114. Which form of mentoring feedback encourages growth? A. Feedback focused on task performance and improvement steps. B. General compliments. C. Frequent reprimands. D. Delayed written summaries. 115. What best describes the purpose of formative assessments in RBT training? A. Summarize knowledge at the end of training. B. Guide ongoing adjustments and learning. C. Punish poor performers. D. Evaluate program funding. 116. A mentor models a technique, then observes and provides coaching. This approach demonstrates A. Lecture-style teaching. B. Behavior skills training. C. Self-paced learning. D. Independent observation. 117. What ethical standard must always be upheld during RBT mentoring? A. Supervisor convenience. B. Protection of client confidentiality. C. Personal judgment on treatment. D. Financial interests of staff. 118. When should cultural responsiveness be integrated into RBT training? A. Only when serving minority clients. B. From the beginning as a foundational element. C. During disciplinary action only. D. After 6 months of field experience. 119. What method increases generalization of learned RBT skills? A. Practice across different clients and contexts. B. Use of static routines. C. Training in a controlled lab setting only. D. Avoiding feedback after mastery. 120. What principle supports adult learning related to autonomy? A. Mandatory attendance without engagement. B. Choice in learning activities and reflection opportunities. C. Closed book, high-stakes testing. D. Repetitive lecture delivery. 121. How can a mentor assess whether an RBT understands ethical guidelines? A. Observe in-session behaviors and use scenario-based questioning. B. Only administer a written exam. C. Rely on peer opinions. D. Ask the RBT to read the code aloud. 122. What is the best strategy when mentoring an RBT on complex procedures? A. Break it into teachable steps with guided practice. B. Deliver the entire procedure in one session. C. Use only written descriptions. D. Skip it if they appear overwhelmed. 123. Which action reflects professional mentorship behavior? A. Prioritizing personal opinions over regulations. B. Maintaining documentation of all supervision interactions. C. Avoiding performance evaluations. D. Giving advice unrelated to job duties. 124. A mentor provides too much prompting during RBT skill instruction. What is the likely risk? A. Increased generalization. B. Prompt dependence. C. Enhanced retention. D. Improved fluency. 125. What should be the mentor's response if an RBT fails to implement an intervention correctly? A. Ignore it if the client responds well. B. Immediately retrain and monitor progress. C. Blame the supervisor. D. Have a peer provide instruction. 126. What defines mastery in competency-based RBT training? A. Completion of assigned readings. B. Accurate and independent demonstration of the skill. C. Memorizing vocabulary. D. Logging training hours. 127. Which mentoring strategy builds rapport and trust? A. One-way feedback. B. Open communication with respect and support. C. Avoiding performance conversations. D. Limiting supervision to paperwork. 128. How does the use of errorless learning support RBT training? A. It minimizes mistakes and promotes immediate success. B. It delays mastery. C. It prevents independence. D. It reduces generalization. 129. Which strategy should a mentor use to promote active participation in training? A. Interactive role plays and guided discussion. B. Only lectures. C. Reading assignments with no follow-up. D. Silent observation. 130. What ensures compliance with bacb supervision requirements? A. Providing 5% supervision monthly and proper documentation. B. Weekly surveys only. C. Peer observation logs. D. Unstructured shadowing. 131. What type of feedback best supports corrective action? A. Feedback that identifies specific behaviors and alternatives. B. Emotional criticism. C. General praise. D. Ambiguous suggestions. 132. What should be a mentor's priority when introducing a new RBT to data collection? A. Model procedures and provide immediate practice opportunities. B. Delay training until errors arise. C. Assign them to observe only. D. Provide only written instructions. 133. When a trainee expresses anxiety about client behavior, what should the mentor do? A. Acknowledge concerns and provide guided support and training. B. Suggest resignation. C. Tell them it's part of the job. D. Ignore it unless an incident occurs. 134. What type of training enhances long-term retention? A. Distributed practice over time with feedback. B. Single-session information dumps. C. Repetition without engagement. D. Rote memorization. 135. What method improves trainee self-evaluation skills? A. Structured reflection checklists and video review. B. Supervisor-only assessments. C. Client feedback forms. D. Group voting on skill levels. 136. A mentor uses feedback forms after each session. What's the benefit? A. Immediate performance insights and documentation. B. Avoids verbal conversation. C. Reduces time spent on instruction. D. Allows trainees to skip sessions. 137. When is peer mentoring appropriate in RBT development? A. To supplement supervision with structured guidance. B. To replace formal evaluation. C. To reduce training time. D. Only with experienced RBTs. 138. What is a benefit of using video modeling in RBT instruction? A. Repeated viewing and consistent demonstration of target skills. B. Reduced trainee accountability. C. Limited engagement. D. Disconnected examples. 139. Which tool best supports tracking RBT competency across domains? A. A skills checklist aligned with the task list. B. Informal notes. C. Verbal summary. D. Generalized praise. 140. A mentor recognizes a pattern of data entry errors. What is the next step? A. Conduct retraining and set up fidelity checks. B. Ignore unless clients complain. C. Send an email without follow-up. D. Assume it will improve. 141. What helps mentors maintain objectivity in performance evaluation? A. Use of operational definitions and scoring rubrics. B. Personal impressions. C. Supervisor opinions. D. Informal anecdotes. 142. Why is inter-observer agreement training important for RBTs? A. Ensures consistent data across observers. B. Reduces supervisor workload. C. Increases client hours. D. Avoids ethical responsibilities. 143. A mentor sees an RBT over-prompting during instruction. What's the best strategy? A. Coach on prompt fading and provide practice opportunities. B. Reassign the case. C. Ignore to maintain rapport. D. Correct in front of the client. 144. What should guide the design of RBT training schedules? A. Availability of clients. B. Complexity of required competencies and trainee needs. C. Supervisor vacations. D. Paperwork deadlines. 145. What mentoring practice enhances transfer of training to real-world settings? A. Simulated and in vivo practice with coaching. B. Theory-based readings only. C. One-time lecture delivery. D. Avoiding contextual variation. RBT assessment. The RBT assessment is a competency-based evaluation required for individuals seeking certification as a registered behavior technician or RBT. Conducted by a qualified assessor, typically a board-certified behavior analyst or BCBA, the assessment evaluates the candidate's practical skills in implementing behavior analytic services. It is based on the RBT task list and includes direct observation of competencies such as measurement, data collection, behavior reduction, skill acquisition, documentation, and professional conduct. The assessment ensures the candidate can apply the principles of applied behavior analysis or ABA in real-world settings under supervision. Successful completion of the assessment is required before taking the RBT certification exam. Here are the top 5 beneficial uses of the RBT assessment. 1. Certification requirement. The RBT assessment is a mandatory step to earn the RBT credential, verifying readiness to implement applied behavior analysis or ABA under supervision. 2. Skill validation. It evaluates practical competencies like data collection, behavior reduction, skill acquisition, and professionalism. 3. Employment qualification. Passing the assessment makes candidates eligible for employment in clinics, schools, and in-home ABA therapy programs. 4. Standardized competency. The assessment ensures that all RBTs meet consistent national standards for ethical and effective practice. 5. Career foundation. It serves as a stepping stone toward advanced roles in ABA, such as becoming a BCABA or BCBA.